I get asked a lot about why I can't give the top 5 things or the top 3 things to intervene for an area. And this is the best summary I can give. If you think about your skeleton, your bones, I look at the joints as a pulley system. So for instance, your shoulder joint is your pulley, but you have many lever arms that cross it. It could be from front to back, rotator cuff to pec. It can be bicep, tricep, because it's front to back and it still crosses the shoulder joint. So if you think of yourself as a series of pulleys and levers for every joint that we're working on, that could be multiple levers for one pulley. So say for instance, you have neck pain and you want me to give you the top 3 things to intervene for it. Will they work? First question, they will work to a certain extent before you plateau, or they will stop working over time. And the reason why is this: very rarely is one area not working well or out in this pulley lever system. Usually you have chronic discomfort in a particular area because your pulleys and levers shifted to make stress occur in a localized area that should not be taking all that stress. For instance, here's your pelvis, connects here, connects to your sacrum. If my hands were to represent where my pelvis is sitting, usually what I'm seeing is that the left one is higher and the right one is shifted forward. That's already a base that doesn't support your spine and your upper body. If your base is up on the left and front on the right, then in your spine and low back, from here to here, low back up to thoracic spine, you could compensate by a rotation this way. You could compensate by a rotation that way. You could have a rotation down here that as you go up, it changes and then it elevates one shoulder or the other. And it depends on you and how you've compensated. Now you're talking about pulleys and levers across this region. Pulleys and levers because each spinal joint has their pulley and lever system as you go up. And now it's affecting your pulley and lever systems at shoulder and neck. But you want 5 things to do, that's very difficult. Because when you want to intervene for an area, you have to address both the lever and the pulley. That's why I give releases and I give mobilizations, because it mimics treatment and you're intervening at both planes. If I were to truly give you a holistic approach that would give you long-term comprehensive relief, it would be that I'm getting you to do something to correct your pelvis to here. Get your spine to want to shift out of the lateral shifts and rotations that it's done, and then the elevations and rotations that have occurred up by your neck and your upper back, and then give you some interventions for your neck and the levers that cross there. That's why the answer isn't so that I hook you onto me. The answer is because I want you to understand comprehensively what is going on with you. Why did your pain occur, and how are you going to attack it at all levels so you can get long-term relief and you don't have to see me once a week for the rest of your life.